Hi, I'm Dr. Stephen Masley, and I'm thrilled to have a special guest with us today to talk about a really important topic. Here we have Dr. Alan Christianson. He's a colleague I've known, I think, for a decade or more now. I'd call him a good friend, and it's someone I trust for the research that he puts into the things he speaks and writes about. And what's really great is he has a new book on a very important topic. And we're going to go through that in just a moment. So, Alan, so much. I really appreciate you joining us today.
Hey, Steve, glad to be with you, my friend. This is awesome.
Yeah, let me introduce you here. I've got your short bio I just want to share so people can hear a little more about you. So, Dr. Alan Christianson is a board certified naturopathic endocrinologist who focuses on thyroid care. He's a New York Times best-selling author whose recent titles include The Thyroid Reset Diet. He's been featured on countless media appearances, including Dr. Oz, The Doctors, The Today Show. He's the founding president of the Endocrine Association of Naturopathic Physicians and the American College of Thyroidology. So welcome, and thank you so much for being here. Now,
Yeah, good to be here.
your focus is on the thyroid. I'm curious, before we get into the details, how did you decide to be like this thyroid guru, thyroid expert? What got you into this specific niche, which is so common today?
You know, Stephen, we've practiced for a lot of years in similar timeframes. I was in my clinical rotations and I was seeing people who were following Dr. Broda Barnes's approach. You know, he was out lecturing and talking about things. And there was basically these two completely different views about thyroid disease. You know, there was his and there was the conventional one. And I saw that, you know, each one had some really good points, but it seemed to my naive eyes that each had some really big downsides. So I thought there's got to be something more than just what's done conventionally, but it's got to be done in a way that's safe and effective. So yeah, it just wrapped me in my early days, and it's about 25 years plus now. I've been still.
So, and we hear it seems to be more and more about thyroid disease. I mean, it seems from my clinical experience, it's more common. I mean, tell us statistically, is thyroid disease more common today than it's been in the past?
It is. And it seems that starting around the late 80s, early 90s, it really went on the uptick. Thyroid cancers are known to be threefold more prevalent now than they were then. And there was a recent paper just showing that the total expenditures for thyroid medications, that's tripled. The number of people on thyroid medications, that's more than doubled. So it's clearly on the rise.
Mhm. And then I think one of the new concepts you bring up is the importance of iodine and how it impacts thyroid disease. What kind of thyroid problems are associated with iodine?
Yeah, there's a few that are not, and that's a shorter list, but most of the big ones are hypothyroidism, hypothyroidism with Hashimoto's, hyperthyroidism, especially from Graves' disease, thyroid cancers, nodules, and thyroid disease, where iodine can be a big factor.
Okay. And how often do you see thyroid disease go away?
Well, going away, I think about that in terms of reversing the symptoms or like it being totally gone, no longer needing treatment. It does happen. And it's most common to those to where they've had the disease for 6 years or fewer. They're not on high dose medication and they're willing to do some dietary change. But it can happen and that's really rewarding.
I mean, one of the things I got from your book, reading it, which I did read cover to cover, really enjoyed it, thought it was a super important book that you've created and written, that it seemed like up to 2/3 of people, if they would address their iodine intake, could either improve their symptoms or reverse it. I mean, is that pretty accurate, that amount of people?
The clinical trials suggested in the between 60 to 80% based on which study and which group, but 2/3 is reasonable. And yeah, this is huge. You know, I've struggled for the last 25 years to find good evidence-based lifestyle approaches. And most things in the past were the effect sizes were small. They might change some surrogate markers by a small amount or improve some symptoms here and there. But to see like the majority of people cured, it's big stuff.
Well, especially for disease that's really common. I mean, at least 10 to 15% of my patients over time have, I mean, more women than men, but both men and women have thyroid disease, and it's super common. It runs in families. I mean, this could really help a lot of people. So what happens when people lower their iodine intake? How can you explain briefly how does that help the thyroid recover and improve people's symptoms and issues?
Yeah, it's a pretty cool thing. And that's the new thing we've learned is that in iodine tolerance, everyone needs some. The requirements aren't that different from person to person, but many people can not tolerate as much as others can. And so what happens is when there's too much, it basically plugs up the thyroid and shuts it down. The thyroid hormones, if there were too much, they could damage the heart. And our bodies get how important the heart is, just like you've understood for a lot of years. So anything that could hurt the heart, we don't do. So rather than make too much thyroid hormone, we shut the thyroid off when there's too much iodine. So it's quite that simple. And then, along with shutting it off, the extra iodine makes the immune system attack the thyroid. And it also makes all of our cells in our body resist thyroid hormone. So when we can get to a point in which our thyroid can get rid of all that extra iodine, the cells can heal, the immune system can stop attacking it, and then the body can respond better to the hormone wherever it's coming from.
So are some people more sensitive to iodine? I suppose some people need more than others. And I also suppose at the same level, some people are more sensitive. How does that tend to work out?
Yeah, so we think about like the lower and the upper end, and the nutritional requirements. There's differences that are pretty predictable, mostly just based upon body size. But past that point, there's not a lot of differences in requirements or absorption. But in tolerance, there is a really big difference. So most nutrients, if we get more than we need, it's no big deal. I mean, of course, any nutrient you could have massive amounts that are dangerous. But the crazy thing about iodine is that more than you need is pretty close to as little as you need. The World Health Organization has said like somewhere between 50 to 200
Mm.
micrograms is probably the sweet spot. And there are many people to where they could have more than that and they can do fine, but they're really not the ones prone to get thyroid disease. Those who are, those are the people that they can't handle even that slight excess.
I mean, we've thought for years, about goiter and low thyroid
Yeah.
planet-wide. So this is kind of a new concept, so it's like we needed more and they put iodine in salt. And I guess we didn't think ahead to think, wow, there's going to be some people who are sensitive to too much, and the treatment in the end could be worse than the cure.
You talked about the fortification, and a lot of that was done exactly for goiter. In the States, it was really when a lot of soldiers were ineligible to go sign up for World War I that they started fortifying with iodine. Too many had goiters on their physical exams. So that's when they thought, look, we should do something about this. They added iodine in, and the goiter rates went down. That was great. But the rates of autoimmune thyroid disease, they went up 26-fold over the following decade after salt fortification. Denmark just saw the same thing in the last couple decades. They fortified their salt in the year 2000, and they did it perfectly. They got
Hmm.
exactly on target. But they saw for 15 years running an average annual increase of thyroid disease by about 50% year in and year out. Yeah. Not too long
So,
ago, we had a lot of countries
yeah. So
that
if
were
it
iodine deficient,
appears the
but many are
most
at iodine excess.
easy reversible issue here with thyroid problems is your iodine intake. Now, in your book, you go into detail, and you've got a really, actually, I think, an exquisite plan that's relatively easy to follow on how people can go about getting the right amount so they get enough iodine but not too much. Can you talk about the foods that are really create the excess source that people commonly overdo? I mean, I know that your book covers that in great detail, but just briefly here for our listeners, what are examples of foods that are likely to put people over the top?
The ones that I think about the most are the ones that have changed the most over this time frame in question. The USDA did an analysis of 23 of the 25, the iodine content has tripled in these last several years. The biggest offenders have been processed grain products, so commercial bread, biscuits, muffins, croissants, bagels, whatever, and then commercial dairy products. And these things, iodine is not really innately part of them. It's not part of grains. It's not even innately part of milk. But in both cases, it ends up becoming a contaminant. And the amounts have just gone up radically.
Okay, so dairy and grains, and how about seafood? I mean, comparatively to the processed grains and processed dairy, how does
You know,
seafood fit in?
you and I feel the same way about just the huge benefits of seafood in the diet. And the amount of iodine in seafood has not really changed over this time frame. And most people, seafood is not part of their dietary intake. So I go through great lengths in the book to talk about ways how people still can include seafood. But during a window of time in which someone wants to really reduce their iodine to heal their thyroid, they do need to think of it as well.
Okay. All right. But I think what's critical here is you've got a short-term plan that people follow to get their iodine levels down into an appropriate level, and then a maintenance plan they can follow after. And it's the maintenance plan is probably, I'd say, easier, much easier to follow. And it's a short-term thing. I think anybody can follow this. What's for the initials plan steps to get appropriate and see the response? You're looking at 1 month, 2 months, 3 months. Can you clarify that for us?
Yeah, to a month to watch for some change in terms of symptoms and blood levels. And if they're seeing some change, they may wish to continue to take that further. In some of the more extreme cases where someone's horribly hypothyroid, they've been that way for a long time, it might take 9 months. I've not seen longer than that. Most typical is 3 to 6. And once someone has gotten their thyroid function stabilized, you're right, they move on to the maintenance plan. And basically, I just broke down all the foods into green light, yellow light, and red light. And during that reset phase, you do all the green light foods. So got access to those. But you can also do up to 2 servings of a yellow light food in any given day.
Okay. Well, I really think you've made it easy. And I mean, for a really common problem, the idea that people have a 2/3 chance of making a big difference in their life, I think anybody with thyroid disease should read this book and give your plan a try. So I'm in full support, and I really appreciate this amazing work you've done in bringing this concept forward. What other what last important messages would you like to share with our listeners out there today? How can they learn more about you, and what more do you really want people to hear before we come to a close?
Yeah, learning more about me, drchristianson.com is the easiest place for all of that. And the thing I'd like them to know is that getting better is there's 2 parts of that. One of which is your thyroid may physically regrow. It might make more hormone again. That's great. Some people, they don't have a thyroid. Their gland is quite strong. That may not happen for them. But we do also see that this change can help make your body respond better to those hormones. So even if you are committed to being on thyroid hormones long term, they could work better for you than they did in the past by these simple changes.
Yeah, I think it's pretty amazing that people might think, okay, they put me on a medication, that's all they can do. But many people still have symptoms despite that. So, despite their levels might be so called controlled, they still are tired. They still may have weight gain. They have issues with their hair. They don't feel that vivacity. You and I know I've known you long enough to realize our passion is making people feel fantastic,
Yeah.
putting vitality back in their lives. And I think oftentimes people with thyroid disease, they're not functioning at 100%. And I think this is a chance. I'm not saying everyone will be able to get rid of their medications, but clearly we can make people feel wonderful again. And whether they need or don't need their medication, I think that's far less important than giving them 100% of their vitality back. And I think this is a big step towards that. So I really thank you for putting this program together. So
Yeah,
can you
appreciate that,
show your
Dr.
book? I think
Graslier.
it's a beautiful book. Can I, make sure we display that. So
Yeah, I like how the cover came out for this one
it
too.
looks
Yeah.
great. Thyroid Reset Diet. I highly endorse it. I think anybody with thyroid disease, if you or a family member have it, please make sure that they get to read this and try this protocol. So thank you so much for joining us.
Yeah, my pleasure. Always good to be with you, Stephen.
Okay. Thank you again. And everybody, thanks for joining in and listening to our host, Dr. Alan Christianson today. I wish you all the best. Okay. All right. Bye. Bye now.